Today is October 21st, 2021. My name is Cristian Doña Rebeco, and I am interviewing Monserrat Cardenas for the Conversaciones Oral History Project, Voces of a Pandemic project at the Office of Latino Latin American Studies at the University of Nebraska at Omaha, and the University of Nebraska's at Omaha Libraries, Archives, and Special Projects. This project is in partnership with the Voces Oral History Center at the University of Texas at Austin. Please know, Montserrat, that this interview will be placed in the University of Nebraska at Omaha, Dr. C.C. and Mabel L. Chris Libraries, Archives, and Special Projects, and share with the Voces Oral History Center at the University of Texas at Austin. If there's anything you do not wish to answer or talk about, I will honor your wishes. Also, if there's something you want to talk about, please bring it up and we'll talk about it. Because we're not conducting this interview in person, I need to record your consent. So I'll ask you a series of 6 questions. Please say, yes, I agree, or no, I do not agree after each one. There are several questions we need to make sure you agree to before we go on. The Office of Latino Latin American Studies and UNO Libraries, Archives, and Special Projects wishes to archive your interview, along with any other photographs and other documentation at the University of Nebraska at Omaha, Dr. C.C. and M. and Mabel L. Chris Library, Archives, and Special Projects. UNO Libraries, Archives, and Special Projects will retain copyright of the interview and any other materials you donate to the Office of Latino and Latin American Studies at UNO. Do you give the Office of Latino Latin American Studies consent to archive your interview and your materials at UNO Libraries, Archives, and Special Projects?
I do. I agree.
Do you grant UNO Libraries, Archives, and Special Projects right, title, and interest in copyright over the interview and any materials you provide?
I agree.
Do you agree to allow UNO Libraries, Archives, and Special Projects to post this interview on the internet where it may be viewed by people around the world?
I agree.
Do you grant the Office of Latino Latin American Studies consent to share your interview and your materials with the Voces Oral History Center at the University of Texas at Austin for inclusion in the Voces of a Pandemic Oral History mini project, which will include posting the interview on the internet?
I agree.
So we have many questions on the pre-interview that we did yesterday, and we use that information from the pre-interview to help in our research. The entire form is kept in a secure Voces server at the University of Texas at Austin. Before Voces sends it to the Benson Library and to UNO Libraries, Archives, and Special Projects, we will have stripped out any contact information for yourself or family members. So that will not be part of your public file. Your public file will only be accessible at the Benson Library and at UNO Library Specials, Archives, and Special Projects. Do you wish for us to share the rest of your interview in your public file and make it available to researchers at the Benson?
Yes.
And last, on occasion, the Office of Latino Latin American Studies and Voces receive requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone numbers or your email with journalists?
Yes.
Okay. Thank you, Montserrat. So to start our conversation, please tell me a little bit about yourself. You know, when were you born? When did you move to Omaha? What do you do, etc.?
My name is Monserrat Cardenas. I was born in Guadalajara. I moved to Omaha, Nebraska 10 years ago. And I went to South High School, and then I started my nursing degree. And I just graduated from Clarkson College a month ago or 2 months ago with a bachelor's degree in nursing.
And how old were you when you moved to Omaha?
I was 16 years old. Yeah.
And why did you and your parents move to Omaha or to the United States?
My parents decided to move to Omaha because I wanted to study. I wanted to go to college, and I'm from a small town, and it's more difficult to go to college if you're not financially stable or if you don't have more. Well, we decided to move because there are more opportunities here in Omaha for me and my siblings to go to college.
And you came directly to Omaha. You didn't move from Guadalajara to another part of the United States and then to Omaha, right? You came directly. You have family. You had
Yes.
family here before moving.
I do have aunts and uncles that live here in Omaha. Yes.
And they came before your parents.
Yes.
So you said that you graduated about 2 months ago. When did you start studying to be a nurse, and why you chose to be a nurse?
I chose to be a nurse when I was in high school. I decided that I wanted to be a nurse because I wanted to help people and I wanted to help minorities. I have always been passionate about minorities. People that speak other languages are not able to communicate. So that's why I decided to become a nurse, to have that opportunity to help others that don't speak English. And so the other reason why I decided to become a nurse was because nursing has different areas where you can grow as a person. If you want to help the children, you can be a pediatric nurse. If you want to work with more critical patients, you can be an intensive care nurse, which that's what I decided to do. And what was the other question?
So when did you start studying? When did?
Oh, I start studying. So it's a 4-year program for the bachelor's. I want to say 2014 when I graduated from high school. I started in Metro where I got all my prerequisites, and then I went to UNMC, and then I ended up in Clarkson where I finished my bachelor's in nursing.
And before your current job as an ICU nurse, you mentioned in our conversation yesterday that you had worked in other places. Can you tell me about where did you work and what did you do in those jobs?
So before I became a nurse, I was a behavioral tech in Lasting Hope and also a manual with the children. So my role was to help people with mental illness, to make sure they were safe. I was helping their nurses to take their blood pressure. I was rounding every 15 minutes. I needed to make sure all the patients were safe. And with the children, I work overnight, and it was pretty much the same thing, but with children. I was always checking on them every 15 minutes, making sure they were safe. I was also helping the nurses in any situations they needed. Then I was a CNA, a certified nursing assistant at Bergen Mercy for a few years, where my role was to take vitals for all the patients assigned to me. I was in the flow pool, so I was in all of the units. I was flow to whatever they needed me. Some days I was the sitter, so I was just with one patient the whole entire shift. And some other days I was working in one floor helping the nurses, taking vitals, checking blood sugars, and taking patients to the bathroom, giving baths or showers or whatever it was needed from me. That's what I did before I became a nurse. And then now I am working as an intensive care nurse, where I'm still in orientation. It's a long process in the intensive care. You have a little bit more training than when you go to just a med surge unit.
Mhm.
So yeah.
Thank you. And before your current job, when you worked as a tech, did you have the opportunity to work with Latino patients to, help them with language, or was it all non-Spanish speaking patients?
No, I was always interacting with Spanish speaking patients. When I was a behavioral tech, I had several Latinos that came to the hospital where I was always translating. I was the one making the phone calls. I was helping the doctors when there were any need to call the families. I was the one calling them. And then when I was a CNA, I had several Latinos that I was interacting with, especially during the pandemic. I was one of, since I was in the float pool, used to float to the COVID unit for the most part. And there were several patients that were Spanish speaking, and they were so confused, and you could see on their eyes were very frustrated because they didn't know the language and they had COVID and there had several complications. So when I walked into those rooms speaking Spanish, they were like, "Oh, you speak Spanish," and their look in their eyes was like hope. There is hope, It was pretty nice to see that.
So talking about your experience with COVID, when was the first time you learned about COVID? Where were you? Were you working where you are now? And what was the reaction that in the hospital or the area where you were working when COVID started?
So when COVID started was when I first learned about COVID. It was March. I want to say March. 2020.
Of 2020, of course.
Yeah. So I was in the hospital and everyone was cleaning everywhere with bleach. I remember that we had a meeting where they were teaching us how to clean the machines, how to wipe off after we come out of those rooms, and they were teaching us how to put on the proper protective equipment that we need to use, like those special N95s masks that you have to use on top of the gown, gloves, and then a face shield and all of those, and how to put them on and what to do when you take them off. So everything was pretty overwhelming for all of us. So when we first got all the supplies, we had plenty of supplies, and we were using one gown to go in and then dispose it. And then we had one N95. But then later on, a couple weeks, we were running out of masks. So we had keep wearing the same mask for a day, and then somebody was recycling them and then putting through like an UV light to disinfect it So because we were running out of supplies, so that was pretty frustrating for the nurses and the techs. But yeah.
And this is even before you graduated, so you were in your second or third year of
Yeah, it was my second or third year, I
third
think.
year.
Yeah, third year of nursing. Yes.
And where were you? Which hospital were you working at?
I was working at Bergen Mercy in the float pool.
The same day where you are right now.
Yes.
Mhm. And did you get any, any conversations with other nurses or all nurses with more experience about what to do? Who trained you to deal with COVID?
So during COVID, the nurses were the ones teaching me what to do and what not to do. So usually the charge nurse in the unit at that time, it was on the fourth floor PCU. So the charge nurse was the one telling me what to do and how to clean the stations and how to make sure all the nurses have all the supplies they needed. Because once you go in one of the COVID rooms, you have to make sure you have everything you need to care for that patient, because it's cross contamination if you come out and then go in again. So some of us, the techs, used to make sure we were close to those rooms. So if a nurse needed something, she will write it on the board, um, on the window, and then we'll try to read it from outside and then give all the supplies they needed through the door. So just to help them.
And when this started, when did you realize that this was serious? When did you realize that this was going to be a longer thing? Was it something that from the get-go, the people with more experience said, you know what, we're here for a long run, or was it something that you found out on your own?
So after, I want to say after 7 months, I was pretty devastated to see all of my coworkers. Some of the nurses were exhausted from caring from those patients. They spend hours in those rooms. We usually work 12-hour shifts, but the nurses are the ones who spend most of the time giving medications and proning the patients. And it takes at least 3 people to prone a patient, depending on their weight or all the tubes they have. So after like 7 months of seeing all of that, I thought, well, this is probably not going to end pretty soon. And it's probably not going to be a short term infection like the other ones that we had before. So it was like 7 months after seeing all of the things about COVID, and but then we got the vaccine, and I was very hopeful. I was, oh, well, there is a vaccine. Maybe it will end it up sooner. And uh, that was pretty um, helpful. And it made me feel like there was hope at the end of the tunnel.
You mentioned also in our conversation that you worked on the floor, but also you worked from home
Yes.
doing the tracing. Can you tell me a little bit about what that entails?
Yes. So I work from home. I had 2 jobs at the time of, in 2020, I had 2 jobs. So I was working from home as a contact tracer. So I was calling, I got all the data from Nebraska, from the website of Nebraska Human Services. Um, I was working with Douglas County and Sarpy County. Um, so my supervisor used to send me all the names of the COVID positive patients, and I was the one calling them and asking if they were in contact with anyone else and asking for their names and phone numbers. So then after they gave me all the phone numbers, I was calling the other people that they were in contact with and letting them know that they might be in high risk of getting COVID, and just getting all the information from the other patients as well. And keep track of all the contacts they have had within, I believe it was a week, 7 days. And then we were also asking if they were in the hospital or if they were at home. And depending on if they were in the hospital or at home, I was asking other questions about symptoms and how they were feeling, and if they needed any help, any either financial or food or anything, any resources. And if they needed any, I was the one providing resources like phone numbers to call for food or any financial assistance that they might need for housing as well.
And how did people react? I never received one of those calls, so I don't know what they are about and how they work. So when people reacted, how they reacted to you telling them, you might be in danger of getting COVID. This is what you need to do.
Most of them are either not in the hospital and they were aware that they were in contact with somebody who was positive. So they were pretty thankful. And some of them were like, oh, I know I have been in contact. So I know how to take care of myself. And they were pretty honest. I don't need anything. Some others were pretty in shock, like, who was it? How did I get in? But I was not allowed to provide information about the COVID positive person. That was confidential. I was just letting them know that they might be a risk. So it was pretty difficult. Some of them, there was a lady that I can think of. She was crying and she couldn't stop crying over the phone because she said that she had a lot of comorbidities and diseases, and if she got COVID, she might not survive. And that was pretty hard for me to know that. And obviously I couldn't tell her who was the one who put her at risk. So that was hard too. Um, some of them, I talked to a lot of Latinos and I provided resources for them to get food and then housing from Douglas County. They were pretty thankful because some of them didn't have the resources to pay rent because they needed to be on isolation.
But at the same time, all this time you've been living at home with your family.
Yes.
How was the dynamics at home, knowing that you were in contact with people who might have COVID or who had COVID, and conversations at home that were about this? How was that dynamic?
So my parents were pretty scared at the beginning because I was working with COVID patients, and I was pretty careful every time I was off work. I will like take off my tennis shoes outside, my uniform, take it off before I even enter the main entrance of my house, and then I will go straight to the shower and then to my bedroom. I wasn't having enough contact with my parents or my siblings because I wanted to make sure they were safe. So, and then I was also like putting bleach on my car because I was really scared to the virus, and we didn't have enough information on how to even kill it at that time. So I was just using whatever I had and whatever I thought it was gonna kill it.
And did your family travel to Mexico in this time, or have contacts with other relatives here in Omaha?
So no, my parents stayed here in Omaha. They didn't travel anywhere, and we didn't have any visitors or family members to come over. Um, Not even friends, because most of my friends know that I work in the hospital, and they were pretty scared to talk to me. And I felt isolated for a while because some people were like, oh, she works in the hospital, she might have COVID. So yeah, it was, I don't know, it was a difficult time. I felt like people didn't want to be close to me, even my family members, some uncles and aunts. They were like, oh, we can talk over the phone. It's and for like family reunions or things like that, we weren't doing anything, just over the phone.
And you mentioned at some point in our conversation that you think that you might have, and your family might have had COVID.
Yes.
What can you
Uh,
tell me about how that affected your family?
so at some point, I had all the symptoms, and then a couple days or a few days later, my mom and my dad started having flu-like symptoms. Then my siblings too. So it was pretty obvious for me that it was COVID. Um, so we decided to just stay home, and we quarantined for I want to say 2 or 3 weeks. My parents didn't work, and we at that time we had online classes, so I was taking online classes, and I was also working from home. I wasn't going to the hospital for 2 weeks, and so that's what we did. Some of our friends brought us food, and then my dad, before the pandemic started, he make sure we had all the food downstairs in the basement. We kept meat and then veggies and all of that. So we had plenty of food and stuff. We didn't have to go out. So I was pretty thankful of that.
And this was early on, or was it sort of
Yeah,
closer to the end of the year?
it was 6 months or 7 months after March. So it was like, I want to say November of 2020.
Mhm. What you also, your family goes to church on a regular basis. Did you stop going to church during this period, or you continued through other
So
means?
my parents, they kept going to church with mass on until the priest said that they were gonna record the mass and it was gonna be over um, live. So we stopped going to mass. We usually go every Sunday, so we stopped, and then we were watching mass on the TV when it was live, or over the internet, YouTube. So yeah, we stopped going to church for, it wasn't that long, but we did for a couple of few months.
And now you're back going to church regularly in person.
Yes.
Since
We have,
when, more or less?
I think it has been, I want to say at least 9 months that we have been going to church. First, we were all going with mass. It was required. And then after 4 months ago, they said it's up to the person. If you want to wear a mask, it's okay. And if you don't, it's not required anymore. So we have been going to church now, more often than before. Sundays and also any other festivals or events. Yeah.
And while you were in home, your parents stay home, you were all able to stay without problem. There was no financial issues. There was not anything of that sort.
Yes. In my house, we live five. My brother, my sister, I have other siblings, but they don't live with us. They're in different states. So we were pretty lucky and blessed that because all of us contribute financially here in my household, so we didn't have any financial issues.
And your siblings that live elsewhere, were you able to see them this period, or did they get sick?
So I have a brother that lives in New York, and I was not able to see him. He doesn't usually come to Omaha as often, but I was able to FaceTime him, and because he works in a restaurant and also in a bar, he did have financial issues because every restaurant closed in New York and every bar. So um, we had to provide and send him money in those times because it was pretty difficult. And then my other sisters, one lives in Vegas and the other one lives in Sioux City. They didn't come, they didn't travel or anything, and I didn't get to see them for at least a year and a half.
What about you? You still have family in Mexico?
Yes. Um, I had I had a grandma and she passed away. That was the most um, sad part of this pandemic because I was working and then I was also going to nursing school. My grandma got pretty sick, and my family from Mexico told us that she didn't have many days to live. So we were gonna go, but because of the COVID, they didn't allow for funeral or any more days for the body to wait for us to travel. And then because of the pandemic, we couldn't go. So we missed that part. We missed the funeral. We missed seeing my grandma when she was sick. So yeah, it was pretty sad for all of us because the last time I saw my grandma was probably 4 or 5 years ago, and knowing that I couldn't go to the funeral was pretty devastating for me.
I can only imagine, of course. Um, but the rest of your family in Mexico, they didn't get COVID. They're all well.
Some of my uncles and aunts did um, got COVID, but they didn't have complications. One of my uncles did ended up in the hospital, but survived COVID, and he is now. My other aunts didn't have critical symptoms that they require hospital or any of that. And then, so as of right now, everyone is safe. Nobody died. Some of them had complications that they still recovering from.
Now, let's go back a little bit to your work. You graduated about 2-3 months ago. When did you start being an ICU nurse?
So working in the flow pool, you flow to any unit that has more needs. So I work in the ICU since I was a CNA. Um, so some days I will work in the ICU, some other days in the emergency department or the PCU floor, which is the COVID, or the med surg unit. So that was 5 years ago. I worked at Bergen Mercy as a CNA for 5 years. And then, so now it's been a couple months since I started as an ICU nurse. on my own.
Mhm. And how, so before you graduated, you worked as a tech, right?
Yes. Mhm.
And besides, being near the room to get the nurses' equipment, how was your regular day during COVID as a nurse, as a tech there?
So as a tech, every day was different. There was not such a regular shift because we were there for whatever needed to be done. Or so my duties, I guess, was to get blood sugars, vitals, and in the trays, the meals, because the people from the kitchen were not allowed to go in those rooms. So I needed to make sure the patients had the blood sugar check, let the nurses know, and then take the tray in. I was also the one giving all the patients baths, make sure they were clean, emptying any drains that they might have, like Foley's or any other tubes. I was the one cleaning those as well, and any other things that the nurse might needed. I was also helping. There were some patients that they were pretty critical, so usually those I just stay by the door and ask the nurse if they needed anything, because those patients, the nurse needs to be there at all times. Like in the ICU, there are some patients that are in 1-to-1, so the nurse is there all the time and she just comes out to ask for anything that they might need, like supplies.
And so COVID started for us here in Nebraska around March. That's at least how I see it in terms of when everything stopped, right? Um, Before March, you were already working at this hospital, you're already a tech there. Was there a moment when they told you, you know what, we know that you're on the floor, but from this minute on, you're going to be just working on this? Or did you still move from area to area, even during COVID?
So during COVID, I remember that one of my supervisors sent me an email saying that all of us that work in the flow pool were probably going to end up in the COVID unit for the most part, because that's where they needed help the most. Um, and when I read that email, I was pretty scared because I was living with my parents and I was scared at that time to maybe get the COVID and then bring it home. And my parents are not as young as myself and they have other diseases. So I was pretty scared, but I kept going. And some days I was in the COVID unit for the most part, but there were some other days that I wasn't. So I kept going to all of the floors still. But for the most part, in those times were the COVID unit.
And as you know better than I do, there have been different waves and moments of more cases and less cases. What have been the most difficult moments of the year for you since March? Is there, you can say, well, I don't know, July of last year was just horrible. I worked 24 hours for 3 weeks. I don't know, I'm just saying, but
I feel that the most difficult time was when the COVID first started, because we weren't prepared as well. We didn't have enough supplies. We were reusing the masks. Um, we were working with whatever we had. Some of the nurses, like myself, now I am a new grad, and during COVID, you have a lot of stress going on because you're a new grad on top of the COVID, so it's pretty difficult. I saw a lot of new grads when I was at tech, um, working in the pandemic, and it was pretty difficult to see them. They were so stressful. Some of them will come out of the rooms crying. It was pretty rough. And then knowing that one day you might not have the supplies to help those patients that you might not have an N95 to go in those rooms to help. That was pretty difficult for me. Um, Another thing that was pretty difficult was that there were plenty of patients and there were not enough nurses to care for the patients. So we were working with whatever we had. Um, the nurses weren't taking their breaks. It was just very chaos those times. It was rough. I still think it's rough for the nurses because many of them have worked in the pandemic and they're burnout. Um, Now they might not have as many cases, but there are not enough nurses to care for those patients. So they're still rough for them and for myself, especially in the intensive care unit where those patients are intubated. So yeah.
Have many of your classmates or the people you work with retire or quit because of the burnout and the pandemic?
Um, some of the nurses, I know nurses from years since I started as a behavioral tech. I know some of the nurses from the psychiatric hospital that I used to work retired because of the COVID. They were about to retire, but they retired earlier because of that. Um, I didn't have to work in the psychiatric hospital during the pandemic because I was working in the medical. But I heard from my nurses, from my psych nurses, that they were also having a rough time because having a patient with mental illness, how are you going to explain to them that they need to wear a mask? Those patients are not in the right mind. So it is very difficult for the nurses to explain to them, you need to wear a mask so you don't infect the others. At that time, they might not care what the others um, either whether they get COVID or not because they're not in their right mind. So some of the nurses told me that it was pretty rough for them to manage to control not spreading the infection with people with mental illness.
Um, so you are an ICU nurse right now. Did
Yeah.
COVID influence in any way your decision to stay as an ICU nurse, or that's what you always wanted to do?
Ever since I decided to become a nurse, I wanted to either be in the emergency department or in the ICU. But then after the COVID um, virus and everything, working with those patients for a few years, um, I knew that I wanted to be with the most critical patients, the people that really need me the most. And some of those families that don't speak English, that they speak Spanish, or sign language, because I'm also pretty passionate about sign language. I knew that I wanted to be a nurse in the ICU, help all of those minorities.
So tell me a little bit about the hospital you work in. It's a private hospital, as I assume, right? It's
Um,
not part of the university, or it's not a
yeah,
government.
it's not part of the university. It's well, right now it's called CHI. It's a CHI hospital, um, Catholic Health Initiatives, and it has also joined Creighton, which is a university. It's a teaching hospital. We have a lot of the students from Creighton, and then also nurses from Creighton. So it is a teaching hospital.
And what about the patients? Will you say that they are from a higher economic level or lower economic level?
Usually we get a lot of homeless and a lot of low-income patients. And we are one of the biggest hospitals in Omaha. So we usually get most of the traumas or most of those accidents or people that overdose. Usually during winter time, we get a lot of homeless and people with mental illness too that need a bed. So we get them first in the emergency department and then they find a place for them to go, usually Lasting Hope or Emmanuel.
And during last winter, did you, as far as you know, did they have to stop receiving some of those people that were seeking for a place to stay or that were overdosed because they were run out of beds or people?
We never closed the doors for anyone. I remember at that time in 2020, we had another floor that right now is closed, but at that time it was open. And it was the 2 North unit. It was open at that time. So we used that unit for the overflow patients. And we used to have, I want to say at least 20 patients in that unit that were waiting for a bed to either go to rehab or a mental facility. So no, they never closed the door for anyone. They had extra beds in other units for the overflow patients. And I know right now they open another area in the emergency department that they use it as an observation. And that's also for like the patients that need a bed, but are somehow stable enough. So they did that for them. So they have to work with whatever they have, but they never close the door for anyone.
And where's the hospital?
It's on 72nd and Mercy Road.
Okay. And so that is not near the main areas for Latinos or for other minorities. But you still receive a significant number of Latinos there, right?
Oh yeah, pretty significant amount of Latinos, yes. Spanish speaking, and we also get Asians, a lot of Asians.
And how did you see that was COVID for Latinos? How, when you interacted with them, we know that COVID has significantly affected Latinos more than other groups in the city. We also know that there's obvious cultural differences between being with a non-Hispanic white and being with Latinos. How did you see those differences? How did they play out?
To be honest, at the beginning of the pandemic, there were pretty much every single COVID patient. It was either Hispanic or African American, but for the most part, there were Hispanics. Every single patient that I cared for at the beginning was Hispanic. So I used to come home and I used to tell my mom, they're my people and I feel pretty useless because I don't know how to help them. Sometimes we don't have a cure, we don't have an antibiotic to help them, and we just have to help the families grieve because some of them we know that they are not gonna survive another night. So we had some iPads at the time where the patients from COVID that were about to die or in comfort cares, they could talk to their families. Some of the Hispanics, there were FaceTime with their families, either telling them their last words or saying their goodbyes, because they were not allowed to any visitors at the time. Now they do allow visitors, but at the time when COVID started, we didn't have any visitors for those families, and some of them, most of them were Hispanics.
You mentioned that this is your people. How and we also know that for Latinos, we are more of you know of contact. We're more of being of touching each other, of saying, of expressing our culture and our uh, love by touching each other. How's that? What was the impact of not being able to do that for your patients, and for the
Uh,
families? How do you see it?
so it was pretty rough for the families. When I was talking to some of the families of those patients, some of them weren't able to talk, and I remember one mom telling me, "I want to be with my son. I just want to feel him. I just want to hold his hand before he dies." And I didn't know what to tell her. I didn't know how to tell her that she wasn't allowed to be in the room. So I had to pause for a minute, um, and then explain to her that it was pretty risky for her to come and then contract COVID. And now it will be two family members in the household with COVID. So that was pretty difficult for us. It was also difficult too, because some of those patients, they wanted to feel that you care. Some of the Latinos, like we know, um, some of us like to have like a handshake or have somebody there, before anyone, like somebody there before you die. So we used to hold their hands with, obviously with gloves, but I know some of the nurses put warm water in a glove and then put it on hand, so they could feel like there was somebody holding their hand with warm water. So but yeah, it was, for the most part, I feel like the Latinos were really affected during the pandemic because of the touch part, the not interacting. The We like to have a lot of family members to come when we're sick. At that time, that was not even an option. You couldn't even have one person. So telling them that that was not allowed, that was pretty rough. And then when somebody died, you take the body to the morgue. So I feel like that part where you say your the goodbyes, or you do like a ceremony um, before they take the body, that they didn't have that during those times. So sometimes people need that to grieve, but unfortunately they couldn't.
And were there priests allowed in the room in the last moments of these people, or not even?
So when the pandemic first started, no, nobody was allowed, but the employees, so nurses, techs, but no anyone else. Now, yeah, they do allow priests, and we have chaplain that also goes, depending what religion. But for the most part, now they allow the priest to come.
So for many of those people who, in case of Catholics that are Latinos, the idea of having the blessed rites and the priest there, that wasn't even an option as well.
No.
And
They
sorry.
do it over the phone, like a FaceTime, or but not face to face.
Mhm.
At the beginning, that was not, no.
Mhm. And how did it, when you came home after these days, which I can only think of being horrible, how was with your family and not being able to also touch them right away, or not able to hold them, or not able to be with your friends, and not being able to talk about this in person. How was that for you?
So it was pretty difficult to come home and just take a shower and go straight to my room. My dad was, for the most part, one, he would tell me, yeah, don't come close to me. And I, I mean, I understand he was scared at the time, but it was pretty difficult for me to know that, like, even my parents didn't want me close to them because they were afraid that they might get the virus. So I was a little, maybe more than a little depressed at that time, um, because I didn't know what to do. We didn't have anything. There was not even a vaccine at the time, and we didn't know how long it was going to take. And I kept thinking, is this the way I want to leave? Should I just move out? Because I don't want my parents to be in this situation, since I was the only one who was working with those patients.
Did you spend some time, in the hospital, living and sleeping in the hospital, or you just stay at home all the time?
I never spent a night in the hospital. There was one time where they asked us if we wanted to stay, we could. But that was also because there was snow outside. Um, and then because the other shift was probably not going to make it on time. But thankfully, they did make it on time, and they gave us the option that we could stay or go. I know there were some of the nurses that did stayed in the hospital in one area where they had, I believe, like sleeping bags, and they were sleeping there.
You don't have to do night shifts.
No.
Okay.
I did some nights when I worked as a behavioral tech, but I never work overnight as a CNA.
Mhm. You mentioned during our conversation that you're back in going to church, that now you see your friends. When did things change for you? When it became more normal, although we know it's not completely normal, but when it became more normal for you?
When I first got my first shot, my vaccine, I feel more safe to be around people, close to my friends and my family. And most of my friends also work in the hospital. So most of my friends are nurses or nursing students at the time. We all got vaccinated. So we started hanging out, going to coffee, getting bread or things like that. So that's when I feel more comfortable being close to them, because even in school, we were always wearing a mask. We weren't going any other places besides our classes or regular clinicals and things like that. But after I got vaccinated, and then after I got my second shot, that's when I started going out more places. I never stopped going out even during the pandemic, but I wasn't going to closed spaces. I was going to parks or open outdoors. I was running a lot during those times as well, because I love outdoors and I love running too. So I was running a lot and then doing outdoor activities. I wasn't going to like stores and things like that, just for like the necessary things. But I always kept myself busy going outdoors.
And more or less, when was this? When did things become more normal? After winter or more
Yeah.
recent?
After winter, I want to say May. Yeah, by May of 20, what is it, 21?
2021, yes.
Yeah.
I know the feeling of not remember exactly what year we're on. Um, so how do you think your profession is going to be different once everything is done, once we're through with COVID?
To be honest, I am a little scared of my nurses because I'm a new grad. Um, I am very excited to be working as a nurse on my own because I used to be a CNA. Now I am a nurse. It is scary at times, but I know I have all the support in the hospital where I am to be successful. But I am scared that many of the nurses are so burnt out and they have been fighting through the pandemic with either mental stress or who knows. They also have, some of them have children, they have families, and I cannot imagine what they have been through. I am scared that some of them might leave and there might be a really shortage in Nebraska or all over the US, because nurses are gonna get tired of not having enough staff to work, or the supplies, or there are many things that the COVID took away from them.
And do you think that, like, living with your parents, you were somewhat more sheltered
Um,
that of that, of all the um, mental impacts that some of your nurses had?
I do feel like living with my parents and my family, my siblings, has helped me survive the difficult times, and all the stress of going to work, to see people dying. And like I said, my people, Latinos, dying, not having somebody there. Every time there was a COVID positive Latino, I was thinking about my mom or my dad being in that bed, not having somebody who spoke the language, um, being with them, explaining them even the little things. Those patients are scared. They didn't want to be there. They're scared because they know that there is not a cure. They don't know if they're gonna wake up the next day. They don't know the nurses. It's just very stressful. So it was pretty difficult, but I do think that my parents helped me a lot with the mental stress that I was going through, uh, going to work and also going through nursing school. My friends and my parents were pretty helpful.
Do you have any other nurses that work with you that are also Latinas or Latinos and can speak Spanish?
Um,
Or you're the only one?
I know there are other nurses that there are few, there are not many Latinas. I know at least two or three nurses. One of them graduated before me, like a year before me. She was a tech, and then she is now a nurse. There is another one that has been a nurse for a few years. And then I know there's a supervisor in the oncology floor that it's also Spanish speaking, but there are not many Latinas.
And so there's been many cases where the fact that we are bilingual, that we are Latinos, that we're asked to do certain things that are more than we usually get to do. Did you feel that at any point that the hospital or your floor relied on you for extra things because you were bilingual and you were Latina?
Yes, so once they know that you speak Spanish, they're always gonna find you. They know where you are. It's like, even if you're hiding, they know how to call you and they get to you to translate or to explain to a patient, even the simple a simple thing. So yeah, there were times where I was asked, even the doctors, some of the doctors and the residents were like, "Oh, we know that you speak Spanish. Will you help me explain this to the patient?" There were some times where my supervisor told me that they're required to use a translator. I can only translate to the patients that I have on my own, that I have contact with them, that they're assigned to me. I don't have to go to a different unit just to translate for a doctor, because they have to use the resources they offer, such as telephone, or they have a Marty. It's called a Marty. It's like a computer where they talk to the patient and the translator or the interpreter is on the other side, and they're face to face through a computer. So they have to use those resources, not to be telling me to translate for them when I'm working with somebody else or when I'm busy with. But yeah, you do feel like once they know you speak Spanish, everyone is trying to get to you and to help them. Yes, which I don't mind at all. It's just those times where I am busy helping other patients. I can just leave the floor and translate to other patients.
And but for your own patients, when you spoke to them in Spanish, that helped them. Do you think that that helped them?
Yes, because even those resources that the hospital offers, which is a telephone or a computer, I feel that it's not have somebody face explaining to you in Spanish what the doctor or the nurse is asking or is telling you. It's not the same. I am a nurse, so I know all the phrases that a doctor might use. I know medical terminology. And I'm not saying that those people that translate are not educated, which they are 100%. That's what they're in that position, but it's just not the same because I work there. I have a way to translate to them how they might understand it better. And if they're my patients, so I know their entire plan of care, so it's easier for me to explain to them what the doctor or the nurse wants them to understand, if that makes sense.
No, perfect sense. Thank you. So we're coming to the end of the interview, and I wanted to ask, how do you think the world's going to be different? Because if the world's going to be different, or how it's going to be different once we, put this behind. Sorry, before I get to that, just one very quick question. Did you get your third doses?
I'm supposed to get my third dose this week.
Okay. And so now, how do you think the world's going to be different after this is all done?
I think it is going to be pretty difficult for all of us. I am scared because, like I said, healthcare is not going to be the same as it was years ago. I don't want to say that it's going to be worse or better, but it's just not going to be the same as before, because we might not have enough stuff to provide the same quality of care. Mental health is going to be huge. I do think that healthcare workers are one of the most affected, because we have seen her and feel a lot of things during the COVID. I do pray for them because it's really hard. And one good thing that I think that COVID might change the world is how to be kind to one another. So I think a lot of people have changed too in a positive way. They're more kind to each other, which is some good thing that the COVID brought us.
Thank you. So is there anything else that you'd like to share with me that I haven't asked, or that I think it's important?
I think it's important for all the Latinos to do some research and try to do their thing and get vaccinated if they're not. I do think that most of the Latinos care about each other, and it's if one person gets vaccinated in one household, that changes a lot in the whole entire Omaha community, because that's how we get the immunity. So I think it's really important that all of us get vaccinated, especially the minorities, because we were one of the most affected.
Thank you. Thank you, Montserrat. I'm going to stop the recording now.